I am Jane Afriye-Mensah, and I come from Ghana in West Africa. In terms of my professional career, I am a pulmonologist and then a physician specialist as well at the Korle Bu Teaching Hospital, which is the premier teaching or tertiary facility in Ghana. I would like to say that I am very excited to be in IASLC. It all started with my interest in lung cancer. And I got this interest because I happened to be working with pulmonary tuberculosis. And then there were a number of times that we saw patients who had lung cancer come through the clinics. Within a short space of time, in my working with the pulmonary tuberculosis cases, as well as at the respiratory clinic in my hospital, I realized that the number of lung cancer cases seemed to be increasing. Whether it was an apparent increase or it was just because it was a tertiary facility, it was an intriguing question on my mind. It kept going on, and that actually sparked an interest that let me look at the cases that we have seen so far over a number of years, and that was just a clinical audit. And surprisingly, I realized that a significant proportion, about 12.4% of all new cases we saw at the respiratory clinic actually had histologically confirmed lung cancer. It was an eye-opener. And then I just thought that we need to look into this because majority of our cases were non-smokers, and somehow there was some preponderance towards women, cases in women, slightly more than half of the cohorts that I discovered. I just kind of Googled, can I find any conference on lung cancer coming up? And that was in 2023. Then I chanced upon IASLC and I registered to be a part of the conference in 2024. And indeed, when I got there, it was exciting. Then I realized that there was a lot going on in lung cancer, and our patient seems to be left out of this. And the disease still had a very poor prognosis amongst us, with nothing exciting in our environment. Nobody talking about the kind of targeted therapy that was coming up, talking about molecular markers analysis in lung cancer. And so I came back and felt that now I needed to start the lung cancer MDT because we're seeing a number of cases. And that is what led to the first setup of a lung cancer MDT in Ghana. And honestly, when we started this, we were able to get the other specialties on board. We got the medical oncologist, we got the pathologist, the pulmonologists were involved, we got the cardiothoracic surgeons as well, and it was good enough to start. We had a number of cases being discussed month on month, and we're seeing about 5 to 7 cases in a month. And so that was the beginning. Fast forward, we grew more hungry for data and to know exactly what is happening in our country. Now, that led to my engagement with IASLC, got more involved, wanted to ensure that those of us on the African continent partake in the new and the novel therapies that are available for lung cancer patients. And so we thought that we needed to improve awareness. We needed to get our patients diagnosed early. We needed to remove the bias between lung cancer and the pulmonary infections that seem to be prevalent in our countries, particularly TB. And we also felt that our patient deserved more. And we needed to look at all that. But we don't have the data. And so step by step, we got to realize that IASLC put up the grants for the African Impact Awards. And it was a nice opportunity to get on board and see whether we could review do a country-wide review of the cases that we had. Perhaps other teaching hospitals were also seeing them, but probably just not reporting because there's no national surveillance for lung cancer. So we took advantage and said that we needed to get a cumulative analysis of a sort, looking at all other hospitals, go review their data, see how many cases they have seen over a specific number of years. And that could give us the first national statistics of a sort. It would not be exact, but we thought that it would be a good thing to start with, where we have national surveillance of what our standing or status of lung cancer is in the country. And maybe I would say that, was it luck? But we're quite happy to be granted the award, and we have just started the project. We've started by trying to get ethical approval from the other hospitals that we need to work with. And this is where we are as far as lung cancer is concerned. I think that we've made significant progress. One, we have been able to start the lung cancer MDT. We are starting what looks like a lung cancer registry, even though it is still very infantile, as in very localized to the hospital that I work in. But we believe that as we work with this grant, as we go forward in our journey with lung cancer, we will be able to consolidate and make things better, not only for the hospital that I work in, but for other hospitals in the country. We have also been able to push up to join other partners in Africa, and we have been lucky to have received an award from the Bristol Myers Foundation, the Multi-Lung Cancer Project Partnership. And so we have this connection with other countries in Africa, and we are together working to bring lung cancer to the fore. Something we thought was not significant in our setting. We are realizing that perhaps it is just underdiagnosis, and perhaps we may have a different epidemiological pattern, but studies will show what our status is. And it is exciting. We've just gotten to in contact with our African partnerships. That is the Multi-Lung Cancer Project funded by BMSF. And we also have the IASLC African Grant Impact Award to look at what pertains in our country. And I think this is exciting for lung cancer in our country. And I believe that the end of it all is for the benefit of our patients so they can have the holistic lung cancer care that exists in other parts of the world. So based on what I have just said, I think that getting to know IASLC has brought a lot of difference in my career and in my country. IASLC is passionate about lung cancer, and they are working hard to get Africa on board as well. They don't want to leave anyone. They want to ensure that those of us in the low resource setting or countries also benefit from the optimal lung cancer care. And I want to recommend IASLC to everyone out there, particularly my fellows in Africa. Get on board IASLC. Just Google like I did. Are you looking for World Lung Cancer Conference 2026? Get on board, participate, and IASLC has a lot in there to help us all, wherever we are, to ensure that our lung cancer patients get the best. Thank you. Just look out for IASLC and be a part. Follow them on their social media handle, be a member, and you would be exposed to a lot of resources and professionals out there, experts who can always guide you through your career in lung cancer.